Hi, I'm Dr. Felice Gersh, back again to talk about PCOS and this time the inositols. First, I'd like to introduce myself to any of you newcomers. I'm an integrative OBGYN physician located in Irvine, California, that's Southern California, where I see patients every day. I utilize the most efficacious and safest therapies to help my patients to optimize their health. Now, as you may know, today is the last day of PCOS Awareness Month, September. I would like to cover a very important and very poorly understood topic today, talking about the inositols. PCOS is the most common endocrine disorder of women. Depending on who you ask and who's keeping really accurate count, it could be as little as 10% of reproductive aged women or as high as 25%. It is really prevalent. It has tremendous array of metabolic dysfunction as well as reproductive dysfunctions associated with it. One of the more effective and really more prevalent treatments is utilizing the inositols. But most people don't really know what is inositol and what is the difference between the two types that are utilized in PCOS, myo-inositol and D-Chiro Inositol. Well, let's talk about what is an inositol. It turns out that it is what we call a polyol. So it's actually a type of carbohydrate. It's really an alcohol sugar made up of 6 carbons. Now, it comes in different types, this family called inositols. And what makes them different is how they are arranged in space. So we call them stereoisomers. Now, here's my hand. Now, my hand is just my hand, but if I go like this, it looks different than if I go like this or this. They are basically different spatial arrangements of the same hand. And that is what the inositols are. They're different spatial arrangements of the same molecule. So they have exactly the same chemistry setup, except they're arranged differently in space. But they can have tremendously different effects. The most common of the inositols in the body is myo-inositol. It turns out that myo-inositol has critically important functions, not just relating to the ovaries, but throughout the body. So the inositols are part of cell membranes, which are critical to cellular health. The inositols are also very critically important in glucose regulation in the body. Now, if you look at myo-inositol, it is critically important in brain function. It's been shown that people who have severe depression, people who've committed suicide, people who have bipolar disease, have low levels of myo-inositol in the brain, particularly in the frontal cortex. So we now know that giving substantial doses of myo-inositol can actually improve the status of anxiety and depression. It's not really frequently utilized by psychiatrists, but we now know that this is true. Now, in the ovary, myo-inositol is the most common of the inositols. In fact, the D-Chiro Inositol, which remember now is a stereoisomer, a different arrangement in space compared to myo-inositol, is also present in the ovary. The ratio in a normal, healthy, reproductive woman's ovary is 100-1. So there would be 100 times as much myo-inositol to D-Chiro Inositol. In women with PCOS, the ratio is more like 12-1. So instead of it being 100 times more, it's only 12 times more of the myo-inositol. And this matters greatly. It turns out that in the ovary, myo-inositol is really critically important to the action of the enzyme aromatase. Aromatase is what converts testosterone into estradiol, the estrogen made by the ovary. That requires substantial quantities of myo-inositol. Myo-inositol is also critically involved in DNA and RNA function. And so it's actually also been shown that high amounts of myo-inositol in the ovary are really important to having a healthy egg quality. So myo-inositol is important not just for making estradiol, converting through the enzyme aromatase the testosterone into estradiol, but also having healthy, high-quality eggs. And it translates, when you have high-quality eggs, into better quality embryos and a better success rate at having successful implantation of the embryo and then having a successful, healthy pregnancy. So myo-inositol has been studied and found to improve embryo quality and embryo implantation in women with PCOS as well. Well, what about D-Chiro in the ovary? Well, you don't want too much D-Chiro in the ovary. It turns out that it's an aromatase inhibitor. So it blocks this action of this critically important enzyme in the ovary called aromatase. And therefore, you can't properly convert testosterone into estradiol. We know this for a fact, that this is what's happening in the ovaries of women with PCOS, that they accumulate too much testosterone because there's no problem in making testosterone, but they can't convert it properly into the estradiol. And it turns out that on a cellular level, higher levels of D-Chiro Inositol versus myo-inositol will actually cause this elevation of testosterone and insufficient production of estradiol. Now, what about in the liver? Well, it turns out that in the liver, you want to have high quantities of D-Chiro Inositol and lower levels of myo-inositol. So how confusing is this? The ovary, you want to have high myo-inositol, low D-Chiro, but in the liver, you want to have high D-Chiro and low myo. Now, in the liver, the D-Chiro Inositol is really critically important for regulating gluconeogenesis, the production of glucose in the liver, and also in liver functionality relating to glucose, and also in the body in terms of glucose sensitivity to insulin. So the insulin's ability to transport glucose across cell membranes and into the cell. Well, D-Chiro Inositol is really important for enabling the cells to bind and then transport the glucose across the cell membrane into the cell, where it then can be utilized appropriately for energy. So how confusing is this? Now, on top of that, to make it even more confusing, they've studied in the brains of Alzheimer's patients and found that they had too much myo-inositol in the brains of Alzheimer's patients. So clearly, there are critical regulatory factors going on in a healthy body to create the proper ratios. And it's really important. They talk about poor regulation or balance between the inositols as underlying a lot of illness in the body. That's how important these inositols are, that you have to have the right balance in the right organ. So we know that when you have a healthy body, you will have the proper regulation of the inositols to go into the right location in the right quantity. So what are we going to do, though, for women with PCOS? Well, we do have some data to help us, but what I want to make clear is that this is still in its infancy, and we need to have lots more data, because it turns out if you give high levels of D-Chiro, if you give predominantly D-Chiro to a woman with PCOS, you may actually backfire, and you'll prevent ovulation because in order to ovulate, you need to get this giant spike of estradiol. Well, you have to be able to make the estradiol. If you don't have enough myo-inositol and you have too much D-Chiro Inositol, then you will block the enzyme aromatase, its action, and then you can't get that giant spike of estradiol produced. You will not ovulate. So that really is underlying the problems happening in women's ovaries with PCOS. So the last thing you want to do is give high amounts of D-Chiro to a woman with PCOS. Well, what is the right ratio? Is there a correct ratio? Well, we know that the ratio is totally different between D-Chiro Inositol and myo-inositol depending on the organ. The ratio is very different in the liver, where you want to have high D-Chiro, low myo. In the ovary, where you want to have high myo, low D-Chiro. And we know that the ratio is really off in women with PCOS, and the consequences, of course, are not good. What about in the blood? It turns out in the blood, the ratio seems to be about 40-1. So that means you'll have 40 times as much myo-inositol to D-Chiro Inositol. So there are products on the market that contain pure myo-inositol that actually has data supporting its use, considering the fact that a healthy ovary has a ratio of 100-1. That doesn't seem like a bad idea to just give myo-inositol and then do other things to try to improve the glucose regulation issues of the body that are abnormal in women with PCOS. Well, you know now you don't want to give pure D-Chiro Inositol because you may be really harming the ovarian function. Now, what about other ratios? Well, there are different products on the market with different ratios, and a lot of people are using 40-1. Well, there is some data to support that, but here are some other issues. If you swallow a pill or some powder that has a ratio of 40-1, that means 40 times as much myo-inositol to D-Chiro Inositol. Do you really know that what they said is in that product is really that amount? Because after all, that's a pretty steep ratio. That means a very tiny amount of D-Chiro compared to a very significant amount of myo. So maybe it's right. Who's doing the testing? I don't know. What's the company? But then what about when you swallow it? Well, it turns out that what you take in your abdomen at the same time, if you're eating food and you take this inositol product, can change how you absorb it. Because remember, I told you it's an alcohol sugar. So if you have a diet that includes other sugars like sorbitol, xylitol, those are also alcohol sugars. They will compete for the receptors for absorption of the inositols in the GI tract. So that can change how it's absorbed. It also turns out that D-Chiro Inositol competes with the binding sites in the intestine for absorption of the inositols. So if you have both D-Chiro and the myo, the D-Chiro may block the absorption of some of the myo. So it may get into the body in a different ratio. So, and then if you swallow it and it actually gets absorbed and it's in the bloodstream, how do you know that it's going to get absorbed and end up in the right ratio in the liver or versus in the ovaries? So there's a lot that we don't know yet. I don't think it's dangerous to take a 40-1 ratio of myo-inositol to D-Chiro Inositol. I also think it's perfectly fine to use a product, a high quality product that is 100% myo-inositol. And then do other things like use berberine, use NAC. These also help with glucose regulation and insulin resistance. And of course, there are pharmaceuticals as well. As you may know, time-restricted eating and many lifestyle issues, exercise, can also help with glucose regulation. So we have many tools in our toolbox to help with that. And the future is very bright. Understanding this really interesting, complex group of polyols, the alcohol sugars called the inositols, is really offering tremendous hope for helping women with PCOS to have better health in a myriad of ways, and not just for women with PCOS. The inositols hold a great deal of promise for people who have various psychiatric illnesses, cognitive illnesses, and other metabolic illnesses. It turns out that myo-inositol has been shown to help reduce fatty acid accumulation, so like fatty liver, fatty acid accumulation in the liver and in the heart. So it may turn out that many people who have metabolic dysfunctions with fatty liver, fatty heart, fatty muscle, and having mood disorders, anxiety, depression, will be benefited by taking substantial doses of myo-inositol. And perhaps people who have type 2 diabetes would be benefited by taking more D-Chiro Inositol. We're talking about people who are maybe males, or people who don't have PCOS, or postmenopausal women where ovarian function is no longer an issue. So the inositols are fascinating. I hope you really find them as fascinating as I do, and that you'll read about them and follow along with me the latest research and developments on the utilization of the inositols in women with PCOS, the most common endocrine disorder of women, as well as in many other conditions that are so harmful and so prevalent in our society. So I will see you again next week. Thank you so much for joining me. Take care and have a wonderful day. Bye.